very honored and privileged to be with this inspiring group of people. I usually talk about medications and therapy and the brain. I won't today. I hope that I can convey a message about the overall arching issue of trauma, from the individual to the community, and how we cannot separate both from each other. Our communities affect us, and we affect our communities. I'm going to apologize for my voice. I think I might be having something. We'll go ahead and proceed if they would show the slides. I'll have some slides. So it's a long title, huh? But I'll tell you why I chose some of these words. And there's something we're trying to avoid in our discourse in mental health. A certain word, hella, we'll talk about it later, the R word. So we are going through very difficult times. These are cataclysmic times, and they've been going on for years and years. And trauma is part of human history, even since antiquity. I came across an interesting piece of information that some people believe that the first case of PTSD is in the Iliad. It's, Ulysses had PTSD, and this explains many of his behaviors, drinking, all the things he did. So after the war, okay. So we are going through times similar to this, and but maybe the scenery is less dramatic. We live in systems, we don't exist in bubbles, and since we are born, we are affected by the immediate family, the household, the neighbors, kinship, the local environment, the broader environment, the national economy, global economy, and any disturbance in any of these spheres eventually will reverberate and affect all of us. In Lebanon, in the case of, we all know these things, but we have confluence tragedies from the chronic instability, the pandemic. The pandemic still affects us. We still see people in the hospital who have long COVID, chronic mental health problems, never recovered from the lung disease, and plus all the trauma of the people we lost in the hospitals. We could not see them. I removed the picture I was going to include. Our psychiatrists used to wear hazmat suits and go into the ICU because our trained junior psychiatrists, somebody had to go in and be with these people where they were passing away. So our junior psychiatrists would wear hazmat suits and go into the ICU. Governmental services, the Syrian war and the refugees, the port explosion, definitely. I see people of the port calamity suffering in all aspects, from some of our hospital workers to some of my students, some of our medical students, and it's just an ongoing tragedy. I started thinking about, many of these people come to my clinic, and their problems are beyond the scope of what I can tell them, say, or do. People who lost their life savings, people who lost family members, people who feel hopeless and helpless. And therapy is not going to fix all these problems, or medication. So if you look, our colleagues at EUB did this group works with children. We looked at the children in Greater Beirut, and more than 60% have serious mental illness now. Those in the vicinity, at least, of the what we showed here, the area. But even children far removed from the actual explosion are extremely traumatized. There's also the concept of transgenerational trauma. And in Lebanon, it's actually never ending, it's ongoing. So we have there's also the important concept of closure and healing for people. So the civil war, has it really ended? There's no closure, no reconciliation. Political assassinations, 2006 war, which now is re-traumatizing people, that memory. So trauma builds upon trauma. The invasion, the Arab-Israeli conflict, so more dots needed, I don't know. Hopefully these things will end. We go back, Ottoman rule, famine, the 1860 strife in the mountains. People still remember that, these things. Older people tell you that, you know, so-and-so did so-and-so to your grandfather, and so the collective memory has not been fixed or healed. What is PTSD? PTSD really is when people are faced with an acute shock that creates helplessness and hopelessness. If the two are present, it's very, very difficult. What are some of the immediate symptoms? Rage, anger, immediate effect, like we're seeing now. It's what you're seeing now, the violence is narcissistic rage. And usually narcissistic rage is severe violence and unleashed when you perceive a narcissistic injury. So somebody's narcissism was injured recently. And the retaliation in psychology is called narcissistic rage. Okay, it's like a blinding rage. Okay? So, but regular people have irritability, flashbacks, nightmares, depression, difficulties concentrating, dissociation, and we see lots of somatic symptoms. Most of my patients, I see them from my colleagues, from the stomach doctors, heart doctors, lung doctors. They figure out that this shortness of breath and stomach pain is coming from somewhere else. So, what happens also to the behaviors and personalities? Definitely things change. We avoid dealing with the issue, and you saw that in the immediate aftermath of the explosion, some people just, they don't want to deal with it. They went on a plane and left, and some of them never came back. They just don't want to deal with it. So this is one way of coping. We startle easily, we're on guard, we're tense. This explains some of the behaviors we see on the streets. If you say a wrong word to somebody, things escalate in our society in dramatic ways over silly things. Difficulty falling asleep. Before all of this, we did a study on sleep issues in Lebanon. More than 65% had sleep problems before all of this, so you can imagine now. Isolation also is a problem sometimes. Some people just withdraw, and I will minimize my life to my home, my office, and I don't want to deal with anything. So other behavioral changes, which we see as we say this is antisocial behavior. These are bad kids or za'ran or all these terms. So these are the scenes we see on the highways, dangerous, reckless things, on the motorcycle. You wonder, how is that person doing this? People who have PTSD have a sense of foreshortened future. They cannot imagine a future. So this is why you become disinhibited. You don't care about doing impulsive, dangerous things now, because what worse is going to happen? So these are sometimes to be able to emphasize. So I lied. There's one picture about the brain. I can't not put something. So and this is because people say mental health or pull yourself together. And the mental health is real. It's not just imagining things. Your brains change. So these are type of MRIs that show the brain in real time. So if you look at people who don't have PTSD and people who have PTSD, you see, you don't need to be a doctor, red is bad. So you see more red. So the brain of that person is lit up. It's like hyperactive. And this is all pumping adrenaline and dopamine, and it's affecting our behaviors and everything. Okay? So trauma as a medical concept really evolved from wars. The first term we had was shell shock from World War I. There was a very nice movie. Actually, I decided I couldn't watch it. All Quiet on the Western Front. It's a German movie, I think, and was released last year, about the shell shock of World War I, where people would be in trenches and bombed for days. So Freud started to examine this phenomena. And these are some of the first mental hospitals were to treat these soldiers. How about collective trauma? Collective trauma is a little bit different, and I found this nice quote by Erickson: "Is a blow to the basic tissue of social life that damages the bonds attaching people together and impairs the prevailing sense of community." Basically, when your community is shattered, and there's nobody left to take care of you, your parents, your street, your neighbors, all these things are ripped apart. In Lebanon, we pride ourselves on the strength of these ties, but they are being strained to the absolute limit. Some examples throughout history, for example, the bombings, World War II, this is Hiroshima. We have an extra factor here in our country, which is not something to be proud about, but failed states fail mental health. There's a direct correlation between insecurity, unfit government, economic collapse, and the loss of the in psychology also the state has a role. It can function as the final parent. Like when I was in the US, if you were homeless, there was nobody, a judge would become your guardian of last resort, and which represents the state. We don't have that system here. So we have an unfit parent, I guess, and hopefully he can be, or he or she, or it, I guess, the state, can be rehabilitated. Historically, we are a traumatized region, scarred by chronic trauma. Competing narratives perpetuate moral injury. This is the importance of storytelling, to listen to other people's stories, because we repeat our stories in our own settings. Stories that we don't share maybe with outside groups. And this just reinforces the narrative. Okay, so storytelling is very important, to listen to the other story. We have serious barriers, cultural barriers to change, the concept of shame aversion, and revenge to redress shame. And these are really barriers to forgiveness and reconciliation. And they are very deeply ingrained in our culture. And so again, we have this historical, religious, ethnic grievances that fuel this cycle of revenge. So what to do? We can give up and go home. But we can look at other examples of what other nations did who had similar chronic violence. The best example, I think, is South Africa, because we never had truth and reconciliation in Lebanon or the region. Canada is doing something similar to address the issues with the natives. So these are some Canadian issues also, and other nations. I think Australia now is doing something similar. At the individual level, what can you do? We develop coping skills. The problem is the coping skills can be good or bad. So this is where training, education, and guiding people. So, for example, religion can be a very good coping skill, but can also be easily weaponized, like we see in our region. So you can use religion for good and forgiveness, or you can weaponize it to fuel righteous anger or violence. You can be proactive or passive. I can withdraw, or I can do something, whatever I can do. Maybe help my neighbor. We can be regressive or innovative. We refuse change, we go back, the old ways only work. We want to recreate the past like it was, unable to evolve. Creative energy or destructive energy. So somebody asked us about this, and we wrote a little. So I specialize also in mental health. I'm a psychiatrist, but also in addiction and sleep. So we were asked to look at this, and obviously substance use is exploding in Lebanon. Incidentally, the region, all of our region, has become the biggest importer of alcohol now. So the growth in alcohol consumption is in the Middle East region. Who knows what this little pill is? This is the notorious Captagon pill. And this little, these are the C's, it's 2 C's. So for the brand, okay? Incidentally, I'm the oldest one, so I'm the last one, but as an author, but all the others, the 4 are not here anymore. And this is from 2021, so they all left, okay? So wellness cannot exist in vacuum. It is social, physical, spiritual, environmental. The environment, the lead and the fumes causes mental health and dementia. So the actual physical pollution affects our mental health. So developing networks, investing in the community, avoiding isolation, avoiding anger. Sometimes it's hard not to get angry. Anger is usually externalizing depression. So when you see somebody who's really angry, stop for a minute and think they probably are very, very depressed. And that can help us maybe empathize before we retaliate and unleash this cycle of anger. again, empathy, I think, of all these things probably is most important. To empathize with yourself and others, and ideally sometimes I think the highest form is when even you empathize with your enemies or the people who hurt you. And this is when you can break the cycle, okay? So thoughts, feelings, behaviors, they have to be recognized and addressed and treated. So the bad word we don't like to use anymore is resilience, because people are bored of it. So I was thinking, what could be a better term? And I thought resilience really is two things. It's fortitude and perseverance. So if you mix these two terms, I think it explains to people what resilience is. Fortitude is to keep on going, and perseverance is not to quit, okay? So stigma is a huge issue. I put this little sticker. This is a US program based in the VA, where they realized, I know time is up, I'm gonna finish soon, to get especially men, they changed the concept, not mental health and psychology. So they coined this term wounded warrior, and they were able to get people to see themselves as fighters who got injured than helpless victims. And this opened the door for many men and soldiers in the US Army, for example, to seek treatment, okay? So we have to be creative. We're not gonna talk too much about this. This is one of our colleagues at EUB. We cannot stay at the individual level. These things I cannot address in my clinic with the fanciest medicine or device or machine or the best psychologist. So our colleague has a very nice article how to shift into a collective mental health program. Again, because we are facing an epidemic and it's going to explode soon. So all these things have to be taken care of. I came also across this nice quote: the wound is the place where the light enters you, okay? So you have to keep on going, instill hope in the community, and hopelessness and helplessness, keywords, have to be countered by anything, by going to a nice concert, a nice venue. Ricardo smiling at the picture. This is a place we both like. And this is me innovating. When we tried to, in COVID, we stopped seeing anyone. People couldn't come. So we were learning how to start our telepsych system, me and the other guys. So it was very challenging to get people to go online and for us to use it, especially the older people would not want to use, especially even the doctors. But it really now people prefer it. They say, I don't want to come, can we go online? So, and finally, peace, I think, is the most important factor for well-being. And you can see this quote by Nelson Mandela. So peace is not just the absence of conflict, okay? It's so many other things. And we have to move forward and remember the past. Did you see this picture before? You saw it in the slides. You were not paying attention. So this is a psychological trick. This is Hiroshima. And they kept this tower. So they kept this tower, and because the only structure that survived in Hiroshima. So they did not want to completely forget, but they kept that tower, and the city grew. Okay, so I wanted to end on that picture, but Salah, it's, okay. So we'll zoom there. I know I warned somebody that sometimes I talk too much. So I am done, and thank you for watching, listening. Okay.